ma'am. I am Jervy Careso, the student nurse from Our Lady of Fatima, Pampanga, who will be having a return demonstration on application of a cold compress. The first is I will verify my patient. Good day, ma'am. I am Jervy Careso, the student nurse that assigned to you today. May I know your name po?
My name is Christine Heidi Alonso.
Your date of birth po?
My birthday is on June 12, 2007.
Your age po?
I am 19 years old.
Can I check your evidence po for confirmation? Okay, thank you po. And I will verify order of a moist cold application to check for negation, duration, and desired temp. And I will also review the medical history of the patient in a medical chart and to check for any contraindication. I will also assess the client's skin, temperature, and pain sensitivity. Ma'am, can I check your skin po? Kailan po if hawakan ko po?
Yes.
Go check po. Thank you po. The other one po. Thank you po. And at the same time, I also inspect for the wound, and if may wound, you check for the size, color, odor, tenderness, and drainage. I will assume that I am talking to the family or significant other of the patient to explain and to provide awareness, understanding, and safety factors of this procedure. The next is I will be checking for the patient's vital signs and mobility. Assume that I've already done that, and I will now identify the expected outcomes. So the expected outcomes is dapat is hindi po ma-worsen yung tenderness ng patient, and hindi po dapat kunin hindi po dapat i-apply ang cold compress when the BP of the patient is higher and the temperature of the patient is lower. I will now ready my equipment. Here in my equipment, I have the alcohol, the gloves, the towel, the basin, and another waterproof pad. In this procedure, ma'am, you will feel a coldness, and if your BP is higher po, I cannot proceed to this procedure. So since your BP is normal, I will now be proceeding. I will now proceed curtains to provide privacy. I will position the patient's bed into the elbow height of the nurse. I will also position the patient, and since the patient is in a supine position, I will now be drape the affected areas. Okay, ma'am. And assume that the affected areas is in her arms po. And now I will be performing a hand hygiene and wear gloves. So next is I will put a waterproof pad or a towel below the patient's affected areas. The next is I will submerge the towel to remove excess moist, and then I will apply it 15 to 20 minutes in the affected areas. And assume that it's already been 15 to 20 minutes. I will reapply and remove the excess moist and reapply as needed. So I will be reapplying it. And after that is I will check for the skin condition of the patient, and if the patients indicate any discomfort or any complication, please stop it immediately. And after that is I will remove the towel and put the patients in a comfortable position. I will remove the towel and put the patients in a comfortable position. And after that is I will be take her vital signs to check for the baseline. So vital signs na ginawa po natin before the procedure. Now is I will be inspect for effectiveness and sensitivity to touch. So, okay, ma'am. May masakit po ba?
Nothing.
And I will now be asked for the level of comfort. Comfortable naman po kayo? Or
Yes, absolutely.
Thank you po. And Since wala naman pong na-worsen, na-identify po natin na wala namang na-worsen sa affected area, I will now be removing my gloves, perform a hand hygiene. I will now be document everything that I performed today, especially the cold compress. Good day, ma'am. I am Jervikin Teresa, the student nurse from Our Lady of Fatima, Pampanga, who will be having a return demonstration of application of hand compress. First is I will verify the client. Good day, sir. I am Jervikin Teresa, the student nurse that assigned you today. May I know your full name, po?
Chat Warrington.
Your date of birth?
December 9, 2006.
Your age, po?
90.
Can I check your ID bands, po, for confirmation?
Yes.
Okay, thank you, po. Next is I will check what type of moist hit, the location, and also the desired depth of the moist hit I will be needed. And I will also check for the medical history of the patient to check for any contraindication. Next is I will assess the client's skin for temperature and pain sensitivity. Sir, okay na po ba hawakan ko po yung skin niya to check?
Yes.
Okay po. And assume that it already be done, I already inspect for the wound, if any, in its size, color, odor, tenderness, and drainage. So, okay naman po. And assume that there is a family member that I've already talked about the procedure and understanding and safety factors of this procedure. Next is it will be needed to check for the patient's vital sign before application of a hand compress. And I will now ready the equipment. I have here the equipment of the gloves, the alcohol, the waterproof pad, and the hot compress. And then, in this application, we will be needing that the patient's blood pressure is normal. And because if the patient is in the low, hindi po natin pwedeng i-apply yung hot compress. And also if the temperature is high, hindi rin po pwedeng ibigay yung hot compress. Ginagamit po yung hot compress sa mga para maano po yung any cramps ng patients para ma-reduce po. And after that, I will now explain the procedure to the patient. Good day, sir. Mag-administer po ako ng hot compress to reduce any pain, tenderness po sa arm niyo po. And I will now close the curtains for the privacy. I will now position the patient's bed in the elbow height of the nurse. I will also position the patient, and the patient is already positioned, so I will now drape the patient's arm kung saan po merong kailangan i-apply yung hot compress. Since the patient's now already draped, I will perform a hand hygiene and wear my gloves. Now, I already wear my gloves. I will put the waterproof pad to the patient's arm, below arm, para hindi po mabasa or ma-damage yung bed. And I will be administering heat compress dun sa part na kailangan po ng patient within 30 seconds. And if any problem occur, need po na stop it immediately and inspect mo po yung nilagyan mo ng hot compress if effective po, if meron po bang other conditions na nangyari to the bruise or any na nandito sa arms ng patient. And after that, para mas ma-check po siya, is kailangan nyo pong i-ask yung client if may na-feel po ba siyang any discomfort. May na-feel po ba kayong masakit or any discomfort while doing the procedure? Okay, and after that, I will be removing this one po, the waterproof pad. And put back the patients into the position para mas comfortable po siya. And I will be now performing a vital sign again to check for his blood pressure and temperature because in this procedure we'll be needing to compare the before and after vital signs of the patients. And assume that it will already be done. I will now remove my gloves, perform a hand hygiene, and I will all document the findings to to the physician and perform what I've already performed, administer a hot compress to the patient.